My name is Jessalyn Morales. I'm going to be the nurse assessing your abdomen. Is that okay?
Yep.
Okay, just a few questions before we start. Have you had any abdominal pain?
No.
Any nausea, vomiting, diarrhea?
No.
When was your last bowel movement?
Earlier today.
Okay, was it normal? Did you notice any bleeding?
No, it was normal.
Okay, let me have you just lay down. I'm going to do a full assessment, okay? Alright, so I'm going to provide for privacy. Lift up my patient's shirt to get a full view. So the first thing I'm going to do is just inspect. So I'm noticing the skin, the umbilicus, to notice the contour and the symmetry, any abnormal pulsations, which there is not, to note if there's any distension, which there is not. Next thing I'm going to do is auscultate. I'm going to start at the right lower quadrant, working my way around the colon to my left lower quadrant. Bowel sounds are active in all 4 quadrants. Now I'm going to listen for any vascular sounds. No vascular sounds heard. Okay, so the next thing I'm going to do is percuss. I'm going to percuss in the 4 quadrants, working my way to figuring out the liver and the spleen. Starting again at the right lower quadrant. Alright, now I'm going to percuss the liver. And now the spleen. Alright, if you could just please sit up and face that way. I'm going to percuss the kidneys as well. Any pain?
No.
Alright, lay back down. So now that we have inspected, auscultated, and percussed, now we're going to move on to palpation. Okay, so while I'm palpating, just let me know if you're feeling any tenderness or anything, okay?
Will do.
Again, doing the 4 quadrants, starting at the right lower quadrant. Any tenderness?
No.
Now that I've done light palpation, I'm going to move on to deep palpation. Any tenderness?
No.
Okay, and now I'm going to do deep palpation of the liver and the spleen. Do you have any tenderness?
No.
Alrighty. Well, that concludes our assessment of the abdominal system. I'll conclude all of the results and pass them on to the doctor.
Thank you.
Thank you very much. 3 minutes.